Okay, so hello and welcome to this discussion this afternoon. As usual, do tell us where you're watching us from. We are interested to know where you are catching us from. Um, this is Menda Menda. Welcome and good to see you. Nancy Taonga. Good to see you. Teresa Mudenda. Welcome. So, yes, go ahead and tell us where you're watching us from. And thank you for joining us and for sparing time over your lunch. Sitole Tali or Toli Sitole from South Africa. Welcome. So today let's talk about a very important organ that you have in your body, and this organ of interest is your liver. Now, apart from the skin, the liver the is a very huge organ. When you look at all your internal organs, none of your internal organs compared to the liver. It's probably the biggest internal organ that you have. Um, and also, even when it comes to function, the liver does a lot more work than any other organ you can think about. Well, maybe apart from the brain, because the brain controls everything else. But in terms of actual work, physical functionality of the human body, a lot of things pass through the liver, and the liver does a lot of work. It's involved in your clotting system. The liver is involved in your immune system. It's involved in processing of chemicals, processing of drugs. There are certain drugs that you take in certain forms, and those drugs will not be activated until they pass through the liver for activation. So the liver also removes or neutralizes poisons that your own body produces. Remember, your body also produces poison of its own. And so, left to itself, your body would actually destroy itself. But again, you see, the liver is there to make sure that whatever poison your own body produces, the liver neutralizes it. And that poison can come out either through your urine or through your number two. Now, this very important organ can fail. Now, when the liver fails, it's also a very difficult organ to identify when it has failed, especially in the early stages of liver failure. It's very difficult to identify. It's very difficult to tell. But broadly speaking, and for the purposes of this conversation, I need you to understand that liver failure is basically divided into two broad categories, and these categories basically distinguished based on time frames. And by the time the liver is said to have failed, it is because huge portions of the liver have actually stopped doing their job. The liver will have completely stopped working, and huge portions of it will have stopped doing its job. And because of that, the liver is said to fail. Now, like I said, there are two major types of liver failure. There's what we call acute liver failure, and there's also what we call chronic liver failure. Now, acute liver failure happens over a very short space of time. You're talking about days to weeks. Chronic liver failure, however, happens over months, weeks to months. And it's a very gradual process, it's very slow. And so, even when you look at the causes of liver failure, you'll find that there are causes that are listed under, acute, and causes that are also listed under chronic. And even the clinical features or the way the person presents, they differ. There could be some similarities, but there's some differences. When do you say that someone has acute liver failure? In the initial stages, you'll find that someone who has acute liver failure will be vomiting, will have nausea, who have diarrhea. So they will have those features in the initial stages. So they'll be vomiting, nausea, diarrhea, such things. They may also have a problem with their appetite. But as the disease progresses, you will find that they will have yellowing of eyes. The eyes become yellow. And this thing, when the eyes become yellow, in medical language, it's called jaundice. It's called jaundice. So the eyes become yellow. Their urine may become yellow. It may even become dark. It's called jaundice. And because the liver is involved in forming, in stopping your blood from, stopping it from bleeding to death, remember the clots, some of the chemicals or proteins that are involved in forming clots to stop you from bleeding come from the liver. Now, when the liver has failed in its acute state, what you will notice is that the patient will be bleeding from everywhere. And they'll be bleeding non-stop. They'll either be bleeding from their abdomen, they'll be bleeding under the skin, they'll keep bleeding. Now, that's the problem. And one of the things that distinguishes the acute liver failure also from chronic is that in the acute phase, there is what we call confusion. Remember I said that your own body produces poisons. It produces chemicals that are very dangerous to your body, especially when you eat certain foods. As your body processes, some of the waste products are very poisonous. So if the liver has failed, those chemicals that your own body has produced from the food that you're eating, they'll go to the brain and cause problems there. And what ends up happening is that the patient becomes confused. And the confusion is what we call in medical language hepatic encephalopathy. The other problem you will notice when the liver has failed, because the liver is also involved in maintaining your sugar levels, the sugar levels will be very low. And if they are not checked properly, that is what may kill the patient. And in the acute phase, you might also have a swelling of legs. And the reason you have swelling of legs or swelling of the tummy is because remember that what keeps the blood in the tubes is an important molecule called albumin, and the biggest producer of albumin in your body is the liver. And without it, you'll find that the fluids are unable to stay within the tubes. They begin to seep into the tissues. And when that happens, people begin to swell. They swell in their legs, they swell in the abdomen, and also you find that the person is always sleepy. And generally speaking, in acute liver failure, people are very sick, like really sick. Okay? Their general well-being doesn't look very good. Doesn't look very good. That's why. And so, even when you look at the treatment of the liver, of liver failure, you find that treatment is targeted towards these things that have really gone wrong. All right. But then, with chronic liver failure, one of the things you will find is that someone will have a very swollen tummy. The tummy will be so swollen and full of water. Then you know that, okay, in addition to yellowing of eyes plus a swollen tummy full of water, you know that, okay, this person has a chronic liver failure. And when you talk to them, you'll find that their history is long. Their history is months. They've been sick for months. And they will also be having weight loss. And some of the features they will have with chronic liver failure may also be related to the disease condition that has brought about the liver failure itself. Now, why am I discussing this? It's because the liver is an important organ, and I was thinking that we discuss it. Now, what are the causes? Some of the causes relate to habits that we have as human beings. For example, if you are into self-prescription, there are people who like to prescribe their own medicine. They go over the counter to a pharmacy or drugstore and they buy their own medicine. They have self-prescribed these medicines, or the medicines were not prescribed by a designated prescriber. Okay? And so you just decide, okay, me, I feel like this. You go, you talk to somebody. They are not even a designated prescriber. They give you drugs. One of the drugs that can actually destroy your liver and you take it for granted is paracetamol, Panadol, simple Panadol. Panadol, when taken in doses that are not appropriate, can actually destroy your liver. And if not properly handled, it can actually kill you. Okay? So be very careful with how you take Panadol. Be extremely, extremely, extremely careful. Be careful how you take it. Be careful how you recommend it to others. So just be careful how you take Panadol. That's why you find that some people who attempt suicide, they will take a huge portion of Panadol to try and kill themselves. But if you get them to the hospital in time, they'll be helped. The other cause for liver failure has to do with some of these herbs that people take, where somebody has told you, go and take this herb or go and drink this herb, and you are taking herbs from someone who is not experienced in that area or someone whose reputation with prescribing herbs you do not know. Herbs can help, but also if the herbs are not well prescribed, herbs can cause you serious, serious problems. And the biggest problems we see with herbs is liver failure and kidney failure. In this area, I'd like to address the men. These concoctions you like buying from the streets for enlargement and for ponya something, be very, very careful with those things. Be very careful because they can actually destroy your liver. The other conditions or situations or issues that can cause liver failure, it's infections. Mainly here, it's usually viral infections, and there are a number of viruses that can cause liver failure. You're talking about hepatitis C, hepatitis B. These are the commonest ones that you will find. Sometimes even hepatitis A is mentioned as well that can cause that problem. And there are several other, viruses, but I thought I just mentioned those common ones. Now, sometimes when it's mushroom season, be very careful with the mushroom season. There's a specific mushroom called Amanita. Be very careful with mushroom season because this is when we lose a lot of people. So be very careful. As you're buying mushrooms, make sure you know what you're doing. Make sure you know which type of mushrooms are edible and which type of mushrooms are not. Some mushrooms are extremely dangerous. They can actually cause you liver failure. And if you're unfortunate, you may even die from it. The other thing that can cause liver failure is your own immune system. So if your own immune system has this turned against you in a disease condition called autoimmune disorders, where your own immune system is attacking different organs of the body, and the liver is not spared from such things. So an autoimmune disorder can also cause you problem, which we call autoimmune hepatitis. Now, there are some disease conditions where your own body is failing to discharge or get rid of copper. So you find that copper continues to accumulate in your body and continues to sit in the liver. And this disease condition is called Wilson's disease. Wilson's disease, these are people who are born with a genetic disorder where their liver or their own body fails to get rid of copper. And as a result, copper continues to accumulate until it causes liver failure. The other thing that can cause liver failure has to do with pregnancy itself. So pregnancy itself can induce a accumulation of fat in your liver. Now, generally speaking, you'll find that accumulation of fat in the liver is usually a result of alcohol consumption. But sometimes you'll find that pregnancy itself can induce accumulation of fat in the liver and also lead to these issues of liver failure. The other issue is if you have an overwhelming bacterial infection, which we call sepsis. If you have an overwhelming bacterial infection, which is affecting your whole body or circulating the entire body, it can also lead to liver failure in terms of that. The other issue has to do with, for example, if you work in an industry where you handle heavy metals or you handle very toxic substances, That's why it's important that if you work in an industry, in an environment where you deal with uh, serious chemicals, from time to time, one of the things your employer has to do is to check your liver from time to time just to make sure that you are okay. So if you're exposed to certain chemicals, just be very careful that you don't end up in that way. The other chemical that can cause liver failure, but this one may not necessarily cause acute. This is usually seen in chronic liver failure is alcohol. Alcohol, when taken in amounts that are not recommended, over time, alcohol will continue to destroy your liver bit by bit by bit by bit. Maybe at one point, we should dedicate a few minutes to just talk about alcoholic liver disease so that we can walk you through the different stages of alcoholic liver disease so that you are familiar with how it happens. But then you find that alcohol is mainly seen in terms of causing chronic um, liver, uh, liver failure. The other things that can cause chronic liver failure is viral infections. We're talking about hepatitis B, hepatitis C, or if somebody has a cancer in the liver, either a cancer of the liver itself or a cancer somewhere else which has spread to the liver, it may lead to chronic liver failure. So in terms of treatment, when you go to the hospital, what your doctors will do is that they will do some investigations, both from your, they'll take blood from you, they may take a urine sample, they may take a stool sample, they may also take, they may do scans, either ultrasound, CT scan, different scans, to just understand what type of liver problem you have, and then they'll treat you appropriately. But understand this, chronic liver failure, okay, suggests that the mainstay of treatment is actually what you need is a transplant. But then you know that in Zambia, liver transplant doesn't happen. Okay, we don't transplant livers here. So you might need liver transplant if it's chronic, although they may put you on medication to maintain you, but just know that what you really need once you get into chronic liver failure, what you need is a transplant. With acute liver failure, if they are able to actually identify the cause and support you and support the functions of the liver while the liver is recovering, patients do recover, although understand that acute liver failure is an emergency. Acute liver failure is an emergency and it should be treated as such. Because if it is not treated as an emergency, other organs also begin to follow and begin to fail as well. So if it's not treated quickly, the kidney will fail. If it's not treated quickly, the brain will fail. Someone end up brain dead if you're not quick enough. That's the problem. And as the kidneys fail, usually you will find that when the liver fails, the kidney will fail together with the brain. And when the kidney fails, the heart inevitably follows. And then that's how somebody dies. And that's why we worry so much about liver failure. Now, how do you prevent acute liver failure? How? How do you prevent acute liver failure? Number one, get yourself vaccinated against hepatitis B, especially if you work in an environment where you know that you're exposed to hepatitis B, get yourself vaccinated. Eat a balanced diet, mainly diets that are vegetable-based, also protect your liver from things, and also gives the liver material to use to protect you as well. And don't reduce your weight to levels that are healthy. Again, you don't want to be obese or overweight because that easily makes you very vulnerable. And avoid this issue of self-prescription of medication. Do not self-prescribe. Should you feel sick or should you require a prescription, get a prescription from designated places. Okay? And should you require herbal medication, get herbal medication from people who are reputable. Otherwise, this business of getting herbal medications that are not prescribed, you are actually putting your liver into problems. I know the biggest driver, one of the biggest drivers that we see, which is a bit of a challenge, it's herbal medications that relate to sexuality, either for enlargement or for tightening or for poignant something. Such medications have caused us a lot of problems in these hospitals. Alcohol. Perhaps the biggest problem in Zambia that we see that leads to liver failure in this country, usually chronic. And if you see a chronic liver failure patient and they are relatively young, generally speaking, it's alcohol. And that's where we have a bit of a challenge in this country. All right. That said, nowadays we see people who like to go for tattoos, and people go for these tattoo parlors and they're tattooed and things. Be very careful. So if you're going to go for a tattoo, just make sure that they are observing, hygiene standards. Because one of the challenges you have with tattooing is that those needles that they use, some people bleed, if not everybody bleeds. So you may be sharing blood with somebody who also had hepatitis B, for example. So straight from getting a very beautiful tattoo, don't be surprised if you end up with acute liver failure, especially if you did not check that the people who are doing these tattoos on you are observing hygiene standards. So if they are observing hygiene standards in your tattoo parlor, you probably have nothing to worry about. But just be careful and check. All right. The other issue is that don't forget that hepatitis B is also sexually transmitted. So if you're going to have sex with a partner that you don't know too well, ensure that you use a condom, because hepatitis B is sexually transmitted. It's one of the most dangerous sexually transmitted infections that people don't talk about that much. We keep emphasizing HIV, but hepatitis B is way more dangerous than HIV. Because whereas HIV may not kill you, hepatitis B can actually kill you directly. So just bear that in mind. That said, we did not need to take so much time off your lunch. We know that this is lunch time, but we thought we'd just bring this information to you so that you are aware. Do us a favor as usual. Share this video. We need this information to go out as much as possible so that people are aware, so people can notice these things, and when they see them, they're able to react in time. For healthy and prosperous citizens, we thank you for your support, and we appreciate the fact that you participate in our goal to see healthy and prosperous citizens by sharing this video. So go ahead and click the share button. And for those that may miss this video, encourage them to subscribe to our YouTube channel, because that's where you'll find this video as well. Even if you want to watch it later on, just go to our YouTube channel and you'll find all the other videos you may have missed in the past. That's where they are, and they're easier to navigate on our YouTube channel. Enjoy your lunch, and we will talk to you later. Do take